So my job today is I'm going to be sharing some of my insights about climate change and human health from the perspective of an emergency medicine physician. So I work 13 shifts a month in the ER. And some people would say, well, why does an emergency medicine doctor care about climate change? And I would say that we are on the front lines of the climate and health crisis, right? So every time there's a heat wave, every time the air quality gets bad, my job gets crazy, right? So I care for that reason. And I also care because as an emergency medicine doctor, I take care of some of the most vulnerable people in our community. And these are children, these are elderly, these are people who have very little social support. And so I care about my patients, and thus what I've been seeing over the past 5 years since I've been looking at this is that climate change is a huge threat to their health. So my objectives for today, I'm going to try to bring into focus the issues of climate change and social justice and explore the role of climate change in widening health disparities, both locally as well as globally. So why are we talking about health? Just to get started. So, the polar bears, they've been sort of our poster child for a long time, but I'd like to propose sort of a new poster child for climate change, right? And these are kids getting asthma inhalers in our emergency rooms, and these are kids suffering after disasters, okay? I believe that human health in particular is a powerful frame to bring the threats of climate change from far off lands, where the polar bears live, to the here and now conversation, because nearly everybody has had an experience of poor health. Additionally, health transcends ordinary political boundaries and hopefully provides a common ground with which we can set goals for our common future. The other reason to talk about health is because if the healthcare sector were a country, it would be the fifth largest emitter on the planet, right? So there'd be like the US, China, Australia, there's a couple more, and then there'd be like the global healthcare sector. The amount of waste and energy that we produce does a ton of harm. And so from the medical perspective, we all took the Hippocratic Oath to do no harm, and we're doing an incredible amount of harm. Additionally, healthcare systems are highly vulnerable to the impacts of climate-related disasters, such as hurricanes and wildfires, which in turn leads to cascading health impacts on affected communities. So recently, The Lancet argued that climate change is the greatest global health threat of the 21st century. Well, at the same time, they argued that tackling climate change could be the greatest global health opportunity of the 21st century for the very reason that climate change transcends nearly every aspect of our health. So to give a recent example, let's talk about the campfires in California. Was anybody in California or in the surrounding areas? Okay, there's some folks in the room.
Still have pieces of it in my life.
Okay, I don't blame you. Yeah, wow. So the campfire burned 1.8 million acres, which is even hard to fathom, and led to over $24 billion in property damage. Additionally, it was the most deadly fire in recent history, claiming about 106 lives. So the health impacts don't just stop with mortality, with deaths. We can say, yes, 106 people died, but millions of people were affected. Some people in this room were affected, right? When smoke plumes from the clouds blanketed cities for weeks, creating air quality that quickly became some of the worst on the planet. I spent some time in Delhi, India, about 2 years ago during the fires, and it was actually worse than it was in Delhi that fall. What we know is that exposure to wildfire smoke is linked to things like poor cardiovascular outcomes, it's linked to stroke, it's linked to lung disease, and it's linked to adverse birth outcomes. But these impacts rarely get talked about in the media, right? We say 106 people died, but nobody talks about, well, there were millions of people who ended up in emergency rooms affected because their chronic lung disease got flared up. So instead, we don't pay attention to these more insidious health effects, and they accumulate, and they erode away at the health of communities impacted. And this is an example of just one disaster. In 2018 alone, there was over $15 billion climate-related disasters, meaning disasters that led to over $1 billion in property damage. So property damage is not even talking about the health impacts, right? And each of these disasters has very unique health impacts, as we'll get to in a little bit. So just to give a little overview and kind of lay out where we're going today, this schematic is taken from the Lancet countdown. And what we see in the top is that increased anthropogenic greenhouse gas emissions lead to what we're calling climate pressures. So increasing temperature, more extreme weather, rising sea levels, and extremes of precipitation. These, in turn, impact exposure pathways. And exposure pathways are those impacts that are most proximal to our health. And these include things like extreme heat waves, air pollution, water contamination, changes in vector ecology, allergens, food supply and quality, and population displacement. So these are the most proximal impacts from climate change on human health. And what we're going to talk about is how these exposures then lead to poor respiratory disease, cardiovascular disease, birth outcomes, heat stroke, and things like that. So let's get started with some examples. So I want to talk about heat, because I think heat is the most tangible of all health impacts. So extreme heat has both indirect and direct impacts on human health. So we know that it worsens cardiovascular disease, and it worsens respiratory disease, and it can also lead to increased risk of kidney failure as well as birth complications. So I know most people think, heat, we see a lot in the media about heat stress and heat stroke, but I also want you to think now that it also impacts chronic pre-existing conditions like cardiovascular disease and respiratory disease. Heat, interestingly, has also been associated independently with interpersonal violence, as well as assault and accidental trauma, especially in the workplace. So there was this funny study where they basically put like an event monitor at a traffic intersection, and they had a thermometer. They were always measuring the temperature. And as the temperature went up, the amount of horn beeps per minute started going up. Because there's something about heat that makes people really agitated. We also know that heat interferes with a lot of medications that people take, like beta blockers, like diuretics, that can make folks very vulnerable. And additionally, heat interacts with some of mental health medications that people take, like antidepressants. And so heat is independently associated with sort of an agitated state in a lot of people. Heat's also independently associated with work-related injuries. So heat kind of affects the way our central nervous system works. It affects our cognition. It makes us more likely to get injuries like slips, trips, falls, lacerations, and there's a lot of really good data looking at that. And so it's important to note that heat and the impacts of it really depend on the individual, and they depend on pre-existing health conditions, they depend on the exposure, and they also depend on acclimatization. And so heat illness, kind of at its root, is really a disease of vulnerability. And for some, we see that even small increases in temperature can lead to catastrophic health outcomes. I think everyone in this room is probably aware that the burning of fossil fuels is impacting our air quality. It's also affecting ozone pollution, and that in turn has a lot of impacts on our health. And this is a slide that actually Kathleen and I made. So physiologically, what we know is that ozone, and we're going to call it PM 2.5, which is particulate matter, the really, really fine stuff that you can't even see. It's less than 2.5 micrometers, okay? It's really small, and it gets deep into your lungs, and it can cross over from your lungs into your vascular system, okay? So it goes everywhere. So ozone and particulate matter 2.5. They can inflame your airways, and they can lead to worsening chronic respiratory disease, such as emphysema, COPD, and asthma. Right? So if you have the disease, this stuff's going to make it worse. But now research is showing that even kids who are exposed to this stuff are at a higher risk of developing asthma to begin with. So it's really affecting our kids on a lot of levels. Ozone and PM 2.5, as I mentioned, can enter the bloodstream. And what they do in the bloodstream is they cause a lot of injury, a lot of inflammation to our blood vessels. And they can accelerate diseases like atherosclerosis, which is hardening of the arteries. They can also affect and worsen diseases like diabetes because it impacts our kidneys. And lastly, particulate matter and ozone can have profound effects on fetal and maternal health, from both direct toxin exposure as well as changes to the bloodstream that affect the placenta, leading to poor birth outcomes and low birth weight infants. So based on projections for poor carbon mitigation scenarios, the future impacts of climate change on ozone levels and ozone-related mortality, now we're just talking about mortality here, could be enormous, with thousands of excessive premature deaths and anywhere from $2 to $15 billion annually in lost life and livelihood. So climate change also impacts water quality and water security. And as this graph demonstrates, over the past 20 to 30 years, what we've been seeing is there's been an increase in North America in extreme precipitation events, which is the fancy way of saying really, really, really heavy rain, okay? Extreme precipitation causes a lot of downstream health effects because it can overwhelm our wastewater treatment systems and simultaneously wash pathogens and agricultural waste into our drinking water, where not all of it can actually be removed before it is put into the drinking supply. So I lived in Philadelphia for a while during medical school, and I think the sewer system in Philadelphia was built like, I don't know, like 300 years ago. And every time it rained, we'd get like 3 to 4 inches of water, like literally just like it would pool in the streets for like 2 days. And nobody did anything about it, and eventually it would just get washed into the river, right? And then you'd see like a mile downstream, there'd be people like playing in the river, right? And this is all this stuff like washing off the street, kind of going into the river. And this is what we're talking about. And in the US, what we observe is that following extreme precipitation events, right, heavy downpours, we see an increase in healthcare utilization. So about 2 days later, elderly folks come in, people who are immunocompromised. Immunocompromised means they have HIV or they're taking chemotherapy drugs, and they're incredibly vulnerable because their immune systems are compromised, as well as children come into the emergency room with gastroenteritis, with diarrhea and vomiting, okay? And so this is bad, but in the US, we've got good healthcare systems. When this happens in developing parts of the world, this is devastating, okay? So hazards, I'm kind of changing gears here kind of quick, just giving you an overview, but hazards from ocean warming also impact health. As you know, kind of from like the 6th grade science experiment, if you add heat, it makes things grow faster. And that's true for all types of bacteria and algae in ocean waters. And so what we're seeing is that bacteria such as Vibrio, and Vibrio is cholera, and cholera obviously causes really bad disease, but Vibrio also has different species that can cause wound infections and all sorts of stuff. But what we're seeing is over the past couple decades that the numbers of infections from Vibrios, the cholera bacteria, are increasing. We also see that we're having more instances of paralytic shellfish poisoning, as well as ciguatera fish poisoning. These are kind of, you might know about these if you live on the coast somewhere. But these are due to the fact that algae, which produces these toxins, is growing a lot faster because our oceans are warmer, and then the fish are eating it, and then we're eating the fish. One area that I've been involved in is looking at the impacts of climate change on Zika virus and the emergence of vector-borne diseases. And when we talk about vectors, what we mean are rodents, ticks, mosquitoes, fleas, things that transmit diseases to us, right? And so as climate is changing, we're seeing changes in temperature and changes in humidity, which impact where the vectors, where the ticks, where the mosquitoes can live. And as a result of climate change, we are seeing that vectors, which have formerly not been in places, are now turning up in places that they've never before been seen. And so one of the sort of poster child examples of this is Lyme disease. And I just pulled these graphs off the CDC website last night. So on the left, your right, is 2012, and each dot is sort of in a case of Lyme disease, right? And so just in 5 years, I know it doesn't look a lot, but look, in 5 years, from 2012 to 2017, the number of cases of Lyme disease. Lyme is transmitted by the Ixodes tick, and ticks their range is dependent on temperature, especially cold winters. And we're not having as cold winters as we used to, and tick populations are not dying off. And they're able to spread into areas that we've never before seen them. So just a quick anecdote. I work in Alaska part-time, and I had a patient come in and he said, I was bit by a black widow spider. And I was like, no, you weren't. I was like, there's no black widow spiders in Alaska. And I think he was probably injecting methamphetamines, but he swears he was bit by a black widow spider. And I mean, I didn't believe him on so many counts, but then I thought about it, and I was like, maybe he was bit by a black widow spider, right? Like, you know, we don't know. All the maps of where diseases are occurring are needing to get redrawn, okay, because of changes in climate. And honestly, I've looked at some of these maps, and they're behind the times in terms of where we're expecting diseases to occur. So you can imagine, you're a family doctor sitting out here somewhere, I'm not sure what state that is. Is that Arkansas? Kansas, thank you. Okay, sorry. Those of you from Kansas. You're sitting out there somewhere in Kansas, and you don't see Lyme disease, you don't treat it. Somebody comes in with that like bullseye rash, and you're like, you know, maybe you remember that that's Lyme disease from medical school 30 years ago. Maybe you don't, right? And so our practitioners need to be educated as to how these disease maps are changing, so that folks living in these areas, when they start developing these diseases, our doctors are able to know how to diagnose them and how to treat them. This is a little bit of an ominous map. So this is from Climate Central, but we're looking at distribution of Lyme disease in 2005 and 2080 under a high carbon emission scenario, and it's going to be basically all over the country. Another disease to keep an eye on, which actually the Lancet sort of follows, is the distribution of the mosquito which carries dengue fever, as well as chikungunya and yellow fever. These are diseases that traditionally don't occur in North America. But what we're seeing is that the mosquitoes, which carry these diseases, are starting to expand their range up into North America. Now, just because the mosquito is there doesn't mean the disease is there. But we know that if the mosquitoes are there, the disease could be there. So there is that propensity for there to be disease in these areas. And what we're going to see is that as climate warms, this line is going to keep moving upwards. I do a lot of work in Africa and in India. And so I follow this malaria stuff too. And this is looking at the incidence or the distribution of Anopheles mosquitoes, which are the mosquitoes in Africa which carry malaria, under different climate scenarios. This is the current range, and B, C, and D are under different climate scenarios. Now what happens is when it's really hot and really warm, mosquitoes kind of come in and you get sort of the seasonal flurry of malaria. That's going to get worse. But more so and more concerningly is that these mosquitoes are going into areas where malaria isn't endemic, where the population is not immunoeducated. Like the population has never seen this before. And so they tend to get much, much, much more sick. Additionally, public health doesn't have the medicines there. And so a lot of this work is building what are called MUSE, which are malaria early warning systems, so that we can predict where malaria is going to be, so we can pre-position vital resources to treat malaria. So I'm just went off there for a little bit. I'm really interested in vector-borne disease, obviously. But climate change is also affecting the incidence of extreme weather events. And so since 2000, the frequency of climate-related disasters has increased by 46%, which according to NOAA resulted in $300 billion of infrastructure damage over the past 20 years, which is a huge amount. And that's not even accounting for health. And as we know, the health impacts are enormous, as Hurricane Maria demonstrated in Puerto Rico. So the hurricane basically completely destroyed the island's power grid and communication networks, and the majority of the island's 69 hospitals were without electricity or fuel for generators. Critical shortages of essential medications quickly ensued. Staff couldn't get to the hospitals because the roads were impassable, and many residents could not access appropriate medical care. So at the end of the day, I think it's really unknown how many people truly died. So I was part of this study where we estimated about 5,700 deaths. But this is only a tiny fraction of the people whose health was affected. And so I was there about 2 months after the hurricane, and I was going door to door, talking to folks and trying to figure out what their health impacts were. And many people were without insulin, were without inhalers. They really had not seen their regular healthcare providers in months and didn't know when they were going to see them again. So this is just sort of a warning to be cautious when you look at these mortality statistics, because there's a lot more behind them. The other thing I want to bring your attention to is that although extreme weather events occur in isolated areas, their effects can be incredibly far-reaching. So this is a map of the displaced survivors of Hurricane Katrina based on FEMA data. And this represents 1.4 million people. And so hurricane here, people go everywhere, right? I pulled this data this morning, actually last night, from this really cool group called what are they called? The Global Internal Displacement Monitoring Center. And these folks are great scientists, and they monitor the numbers of displaced people. This is data just for the US. People displaced in 2018, the number is 1.3 million people due to climate-related disasters, just in 2018 alone.
Could you repeat that one more time?
Sure. This graph is showing that just in 2018 alone, there were 1.3 million people displaced, forced from their homes, due to climate-related disasters in the US. Globally, in 2018, so there were 18 million people displaced. 28 million new refugees, but 18 due to climate-related disasters. They monitor all internal displacement, and that's due to armed conflict as well as climate-related disasters. So it's kind of balled together. But when you pull out 18 million globally in 2018 alone. So drought is another example of extreme weather that has huge impacts. So water scarcity coupled with extreme heat can contribute to things like crop failure with cascading economic and nutritional impacts. And so of course, when there's crop failure in the US, we bail out the agricultural sector. The federal government bails out the sector. But when this happens in developing parts of the world, there's no bailout, right? These people just go without food and without any income. And so drought can result in food insecurity, economic insecurity, malnutrition, loss of life, and I would argue even escalation of armed conflict. And last but not least, climate-related disasters have far-reaching mental health impacts. And this is still happening in India, where droughts get so extreme that we have these epidemics of farmer suicides because they're in so much debt and they don't see any other way out. And so these mental health impacts have the potential to really undermine the social fabric of a community in which a disaster has occurred and impair reconstructive efforts and economic resolution. So what I'd like to sort of transition to is the notion that the health burdens of climate change are not evenly distributed across the population. And I've been touching on that, and I think you all probably get that. Some individuals and communities are more vulnerable, and for a variety of reasons, but I think the major groups I'm thinking of is they're vulnerable because they have greater susceptibility, they have greater exposure, or they're less able to cope with and recover from damages. So examples of those with greater susceptibility include children, elderly, women, especially pregnant women, disabled, those with chronic health conditions, and then I put indigenous people and tribal communities, immigrants, and communities of color here. Then there's those who have greater vulnerability due to greater exposure. And that can be due to factors such as living in an urban versus rural environment, coastal versus inland habitation. Others are increasingly vulnerable due to racial disparities and underlying environmental justice issues in communities, as well as poor housing, poor urban planning, and I would say occupational risks. There's also incredible variability and this vulnerability in the capacity of individuals and communities to cope and recover. And this depends on a lot of things such as socioeconomic factors, social support, access to healthcare, and access to job markets and education. But what we see at the end of the day is that those who have more vulnerability, for whatever reason, suffer a disproportionate loss of health and assets in the face of climate hazards and thus suffer from greater inequality. This is a really bad Venn diagram. I made it myself because I couldn't find one that had been made, but just bear with me. So what we're seeing is that we've got biologic vulnerabilities, we've got sociocultural vulnerabilities, and kind of community geography vulnerabilities, but they overlap, right? So people have multiple different vulnerabilities, and I think we can all agree, that an elderly person who's homebound, who lives on the coast of Florida and doesn't know anybody is very high risk, right? And that's just kind of what this is saying, is that you can have compounding vulnerabilities that make you at very high risk of either poor health outcomes or death and disability. There's also this issue that vulnerability sort of begets vulnerability, right? So with climate hazards, it's not like, if you live on the coast of Florida, every few years there's a big hurricane, and so these climate hazards can accumulate. They can accumulate on your property and on your health. And so we sort of see how climate can create poverty trapping. Climate change creates poverty trapping, where you have greater exposure and vulnerability, and then as a result of that, you suffer disproportionate loss of health, and then you're even more vulnerable and when things happen again. So on a global level, what we can see is that climate change threatens nearly all 17 goals and 169 targets of the UN Sustainable Development Goals. There's some specific targets here on climate action, on reducing inequalities, on gender inequality, and things like that. But what we know is that climate change impacts all of these. And the Sustainable Development Goals are really working towards creating just futures for everybody and equality, essentially. And climate change is impacting all of these in various different ways. So what I want to do is highlight a few vulnerable populations just to give some examples. So, did anybody here go to a youth climate march? Yeah, nice, cool. I love this sign. What they say is that climate change affects us the most. And it's true, and the World Health Organization would agree, because they estimate that 88% of the health impacts of climate change fall on children. And this is because climate impacts health at all the vulnerable stages of development, and health impacts early in life are amplified throughout the life of a child. So I'm going to give you some examples. In the prenatal period, when moms are exposed to extreme heat or poor air quality or infection, this can lead to preterm delivery and poor birth outcomes for kids, which can have impacts that last a lifetime. During infancy, kids are at much higher risk of heat-related illness because their heat regulatory systems aren't quite developed enough, and so they can't cool off when they need to or warm up when they need to, and they're dependent on caregivers. Also, they have very underdeveloped immune systems, so they very easily get sick when they're faced with any waterborne disease or vector-borne disease. Young kids are incredibly vulnerable to risks such as undernutrition, which can lead to irreversible stunting and affect both physical and cognitive development. Young kids are also very susceptible to diarrheal disease from compromised water supply, and diarrhea is still one of the leading causes of death in kids under 5. So these are maybe impacts that affect young folks not in the US, but I think we need to kind of think globally when we think about health. Older children are highly susceptible to negative impacts from air quality. So kids who have asthma, every time the air quality gets bad, they end up in the emergency room. We also know, as I mentioned before, that air quality can independently be a risk factor to developing asthma. And also, kids who are playing outside are at risk for injury and death from high heat exposure. Adolescents are at risk for heat injury as well. And they're also at risk for mental health and cognitive impacts following disasters. And so what do I mean by that? What people have shown is that kids who experience natural disasters, when you do cognitive testing on them months afterwards, they lose their spatial temporal reasoning skills. And I'm not a psychologist, I'm not even I don't know anything about this, but they lose their ability to really kind of put things into space and time as a result of experiencing severe trauma. And kids are also way more vulnerable than adults to developing mental health impacts following exposure to natural disasters. So they have higher rates of PTSD and depression and anxiety. So yes, I think we should listen to the youth. I think that they are the ones who are going to be most impacted, and I think they've got a lot of really great signs. So I want to move on and talk about women. I've been doing a lot of work kind of looking at women's health and climate change, and I just want to share some of that with you. The American Congress of Obstetrics and Gynecologists, as well as the World Health Organization, have recognized that climate change is an urgent women's health issue because it has the potential to undermine the well-being of all women, including their safety, their security, and their access to health care. And these organizations have called for proactive steps to protect women's health. And so here's why. So studies have shown that vulnerability to heat waves varies by gender, and that in general, women are more likely to die in a heat wave. Pregnant women are also especially vulnerable due to the way that heat can impact diseases that go along with pregnancy, such as gestational hypertension. That means having really high blood pressure in pregnancy. So what we're seeing here are globally kind of looking at what are the major causes of maternal mortality. And pregnancy-induced high blood pressure that's impacted by heat, as well as pre-existing medical conditions in pregnancy, and that's also, as we've talked about, impacted by heat and climate change. So what we can show is that pregnant women in general, are more at risk of heat illness. And so why is this? Is this kind of bizarre? But underlying these statistics we see both biologic vulnerabilities as well as sociocultural vulnerabilities. So women have a higher metabolic working rate. We also are less able to dissipate heat from sweating. That's just kind of how we're built. And compounding this may be things like culturally prescribed heavy garments, poor access to healthcare and cooling facilities due to personal safety concerns or a lack of personal transportation. Simultaneously, I would say that the biggest risk is the fact that nobody's really aware of this, right? Healthcare practitioners don't really talk about it, and politicians don't really know about this, as well as people who coordinate healthcare facilities. We don't have a large awareness of the fact that women are more vulnerable to heat. We also see gender disparities following extreme weather events. So overall, we see that women are more likely to die during hurricanes. So in 1991, when cyclones in Bangladesh killed 140,000 people, 91% of the victims were women. And then there was Cyclone Nargis in Myanmar, and there were 130,000 deaths, 61% were women. We also see that after extreme weather events, that women who survive are more likely to experience a decreased life expectancy. They don't live as long as a result of the multimodal trauma that they're going through in terms of physically, emotionally, mentally. At the same time, we see that in the aftermath of disasters, women and girls are at incredibly high risk of both physical violence as well as sexual violence, and this is especially true among women belonging to marginalized sectors of society. And not surprisingly then, women and girls are at higher risk for mood disorders such as depression, anxiety, and PTSD after disasters, and they've been found to suffer disproportionate job loss and stagnant personal economic recovery after disasters. And I think all these things are related. Now, the causes of this, I think, are really multifactorial, and there's a lot of work right now trying to understand them because we need to understand what's going on so we can start developing ways to protect people. So it's been found that the gender difference in mortality is worsened when women have a lower socioeconomic status in a particular region. Other research suggests that behavioral factors contribute, so women tend to be homebound, caring for children and elderly, and they're waiting for relatives to return before they evacuate. We've also found in some areas of the world where there is public health messaging telling people to evacuate, the language is not the local dialect. Like they'll broadcast it in French when most women in that area don't speak French. But some of the men do because they have more education. But women are speaking a local dialect. They can't understand public health warnings, right? They're also not allowed to be in the marketplace for cultural reasons unaccompanied by male relatives. So they're at home, they're not getting the messages. We also see that after disasters, women of all ages in general are more calorie deficient than men, which may contribute to poor health and vulnerability to resource shortages after disasters. And the other issue that impacts women is water security and food security, which have been identified as two of the largest health impacts of climate change in the 21st century. And so globally, there is an uneven distribution of fresh water, as we know, with the highest scarcity in the most populated areas. And experts predict by 2050, 300 billion people will be living in water-stressed geographic basins. And in regards to food security, it's predicted that we need to increase food production by 77% to feed the population by 2050. These are just some statistics, but just kind of for a reference point. So in a lot of parts of the world, traditionally women have the household role of providing water and food for the family. So water scarcity equates to more time spent harvesting water and less time spent on other activities of livelihood, such as education and economic gain. So it's estimated that in Kenya during the dry season, 30% of a woman's daily energy expenditure is spent harvesting water. And then, so for example, if you have a family of 5, you need about 100 liters of water a day. And so 100 liters, sometimes having to be carried about 2 to 5 kilometers every day, leads to a lot of physical strain on our bodies, and additionally exposes women to a lot of threats like heat stress, like traveling alone unaccompanied, like going to water collecting areas that might be contaminated with toxins or with other biologic pathogens. And so there's a lot of exposures that come along with this. Women are also inherently sensitive to the effects of food security. So this is really cool, but in the developing world, about 60 to 80% of all food is grown by women, which I think is really neat. However, women own less than 2% of the land. And of the 2% that women own, 1% of them actually have any insurance on their land. So although women are growing a lot of food, they have no access to ownership of the land, nor access to any insurance or any financial securities related to that. So when there is a drought or when there is a flood, women's livelihoods are affected, and additionally their nutritional status is affected because they can't grow food to sell it and they also can't grow food to eat it. And these types of patterns can be intensified by household food hierarchies, so preferentially feeding men in the house instead of women, which happens really more commonly than anybody recognizes. And as we know, undernutrition has profound intergenerational effects, leading to a lot of pregnancy complications and complications for kids. So. Lastly, climate change and the resulting environmental change is an emerging driver for human conflict and forced migration. And we know that regions of the world with incomplete governance, underlying poverty, and poor access to healthcare, climate change acts as a threat multiplier for civil unrest. So globally, there are 80 million refugees. I think that's probably an underestimate. But 80% of them are women. And the health needs of these women, both immediate and long-term, are enormous. So I spent last summer in Lebanon, right on the border of Syria. It's really, really, really hot there. And What I learned when I was there was that between 2006 and 2010, the region experienced the most severe drought that they've had in the past millennia, which turned 60% of Syria's fertile land into desert and killed 80% of the livestock. So this drove like 1.5 million refugees from the rural areas into cities which were already overcrowded, with millions of refugees from the Iraq War. So now you've got cities that are just getting inundated by refugees from environmental crises and resource scarcity. So I was there in a medical capacity, and I happened to be one of the only female providers who came over in this medical mission. And we completely underestimated these statistics that 80% of what we were going to see were women. I'm kind of shocked, but we did. And so I ended up seeing about 50 patients a day, for weeks and weeks on end. And what I noticed was the health needs were all across the maps, right? People wanted family planning. We never even thought that people would want that. People had surgical needs. They needed prenatal care. I mean, there was just this whole gamut of health needs. And so we set up these tents. We actually used the tents that people were living in the refugee camp. But because, of course, women needed privacy, we had to keep the curtains down. And it was like ambient temperature was about 100 degrees. And so we additionally had to go into these tents where it was literally just like an inferno. And then we had like one fan. But the energy grid there, like the electricity kept cutting out. And I think like almost every day I got heat illness. Like it was just unreal. But it was also really incredible. And I met some awesome people that have inspired a lot of the work that I want to do. And so these women here, and here, these are refugees who were in the midst of nursing school when they had to flee. And luckily they spoke some English. They also spoke a lot of the local dialects, and they came to help me. Like they showed up one day and they were like, do you need help? In like great English, and it was incredible. And so they were translating, they were taking blood pressures. I mean, they were like doing urine analysis. I was teaching them how to use the ultrasound machine. And one of the things that is a huge problem in refugee camps is you have people who are completely educated and want to continue their training, but have no avenue to do so. And so this is a huge area where I think, if we want to improve the health of refugees, that we need to take refugees who are not helpless at all, who have incredible skill sets, and give them access to education. The last vulnerable group I have time to mention is outdoor workers. So between 2000 and 2018, it is estimated that the US lost nearly 1.4 billion labor hours, particularly in industry and agriculture. So these hours were not lost because people just decided it was hot and stopped working. These hours were lost because workers were literally coming up against the health limits of heat stress in trying to perform their work. And this is not done without harm. So according to data from the Bureau of Labor Statistics, work-related heat exposure killed roughly 800 workers over that time frame, and additionally injured about 70,000. So, we lost work, but this is because people were really getting sick trying to work. What we know is that pre-existing medical conditions that are exacerbated by heat exposure are often incorrectly reported as the primary diagnosis, which may conceal the role of heat as an inciting factor. So although we say 800 people died, there was probably a lot more than that. When you're filling out, death certificates, you don't say, oh, they died of heat. It's like they died of a heart attack, but why'd they have a heart attack, right? So there's probably a lot of underreporting going on. Additionally, workers have been found to underreport to employers or health authorities that they're exposed to a lot of heat and that they're getting sick from the heat because they're afraid of losing their jobs or other punitive action. And this is particularly relevant for undocumented workers, as well as migrant workers and individuals grappling with extreme poverty. So this is a big problem because the most vulnerable, who we want to really go in and protect, are completely silenced out of fear. We also have the issue of reporting requirements. And so with the Bureau of Labor Statistics, there's several different groups that are exempt from reporting, including federal agencies. So if you're a federal worker and you get injured by heat, your heat injury does not get reported. Additionally, if you work in a farm that employs less than 11 workers, those are exempt from reporting requirements, as well as household workers. There's a few other categories where you're like, why are we exempting these groups? Like, there's clearly injury going on here, and we're just not capturing it. And so I would say, these statistics are probably a large underestimate of what's really going on. But even with incomplete documentation of heat injuries, they're found to be one of the largest contributors to worker compensation claims. So this graph is great. It's by a group called Chen et al. And so what we're seeing in beige is the number of worker injury claims. And blue is the daily minimum temperature, and red is the maximum temperature. So like injury claims literally like flow with temperatures. And what we know is that the cost of worker compensation claims is equal to about 4 to 6% of the GDP of most countries. And a large percentage of that is from heat. And so it's having a huge economic impact. And currently, this is sort of shocking, but there's no federal standard to protect workers. So OSHA is the group which should be regulating this and is not. NIOSH, which is the National Institute of Occupational Health Safety, has given OSHA like multiple different documents saying these are the risks, these are what we should do, and there's still no federal standard. California and Washington have enacted their own state-level standards, and Minnesota has standards that apply to mostly indoor workers, not really outdoor workers. So as a result of that, NIOSH estimates that NIOSH estimates that 260,000 workers are at risk for heat-related illness at any one time. So huge impacts. So I think I've kind of shown we sort of have our work cut out for us now. Lots to do. Just want to make you aware of this in the last minute. The health community, and I feel like all these different communities working on these issues are really fragmented, but the health community is trying to get themselves together, and they came together and came up with what's called the US Call to Action on Climate, Health, Equity, a policy action agenda. And these are some of the main things I want to kind of bring to your attention that the health community is working on, including equity being central to climate action, engaging the healthcare sector because we have sort of this powerful frame to offer, incorporate climate solutions into all healthcare and public health systems, invest in climate and health, we all need more money, we do too, and invest in policies that support a just transition for workers. So that's what I've got for you. Thank you all for your attention.